Hello, friends. Have you ever checked your blood pressure, seen that it looked perfectly normal, and then wondered if you really still needed your medication? It's a question many people ask. In fact, one viewer recently commented that doctors always insist you need pills no matter what. But is that actually true? Today, here on the Weird Lab, we're going to explore what blood pressure medications can do, what they can't do, and why relying on a single blood pressure reading can sometimes give you a false sense of security. More importantly, I'll share some powerful lifestyle changes that may help improve blood pressure control and, in some cases, work alongside medication even more effectively than medication alone. Before we get into that, I want you to think about something. Ask your mother, grandmother, or an older relative what they were doing on April 11th, 1945. Not this year, 1945. That date is significant because it is closely tied to why blood pressure treatment became such a major focus in modern medicine. Despite having access to more than 200 blood pressure medications today, strokes remain incredibly common. Thousands of Americans experience a stroke every single day. This isn't a yearly statistic or a monthly estimate. It's happening right now. I've spent nearly 3 decades caring for patients and helping people manage high blood pressure and its complications. The reason I'm making this video isn't to frighten anyone. My goal is to help you understand the facts and give you tools that may lower your risk, because the reality is that many strokes can be prevented. We'll talk about why a normal reading doesn't always tell the whole story, what medications are designed to accomplish, and what they cannot accomplish on their own. We'll also look at a fascinating historical example involving President Franklin D. Roosevelt. By examining what remains of his medical records, we can better understand the factors that contributed to his stroke. Interestingly, parts of those records disappeared decades ago and have never been recovered, but enough information remains to reveal important lessons. Even with all of today's medical advances, strokes continue to affect people at an alarming rate. In the United States, someone experiences a stroke roughly every 40 seconds. Every few minutes, another life is lost because of one. And for those who survive, life is often never quite the same. Physical abilities may change. Memory may change. Personality may change. The impact spreads beyond the individual and affects families, friends, workplaces, and entire communities. That's why blood pressure matters so much. It isn't simply a number displayed on a monitor. It's a reflection of the stress being placed on your arteries and vital organs. Knowing your blood pressure and monitoring it regularly is one of the most important things you can do for your long-term health. Now let's talk about what normal blood pressure actually means. Many people assume lower is always better, but that's not necessarily true. Blood pressure that falls too low can cause dizziness, weakness, and even fainting. Like most things in the body, balance is the key. Blood pressure measures the force created when blood pushes against the walls of your arteries. Your heart acts as a pump, generating that pressure with every beat. The top number, called the systolic pressure, measures the force created when the heart contracts and pushes blood outward. The bottom number, known as the diastolic pressure, reflects the pressure when the heart relaxes between beats. Current guidelines generally consider a systolic pressure below 120 to be ideal. Research following over 1 million people has shown something remarkable. For every increase of about 10 points in systolic blood pressure, the risk of heart disease and stroke rises. This pattern appears across all age groups, although the impact can be especially significant in younger adults. Definitions have changed over the years as scientists learned more. In the past, a reading above 140 was commonly considered stage 1 hypertension. Today, many medical organizations classify readings above 130 as stage 1 hypertension, because evidence shows cardiovascular risk begins increasing earlier than previously believed. One thing many people don't realize is that blood pressure is constantly changing. It is not a fixed number. Your thoughts, emotions, activity level, sleep quality, diet, and even your surroundings can influence it. Simply feeling stressed or anxious can cause your blood pressure to rise. Medications can lower it. Exercise can affect it. The foods and drinks you consume can influence it as well. One viewer shared an interesting experience. He had stage 2 hypertension and decided to add beet juice and whole beets to his daily routine. After a couple of weeks, his blood pressure dropped dramatically, moving from a dangerously elevated level to a much healthier range. That's an incredible improvement, and something he should feel proud of. Of course, if you're considering making significant dietary changes, especially if you're already taking blood pressure medication, it's important to discuss those changes with your healthcare provider first. So why might beets help? The answer lies in naturally occurring compounds called nitrates. When you consume foods rich in nitrates, your body converts them into nitric oxide, a powerful molecule that helps blood vessels relax and widen. This process can improve circulation and support healthier blood pressure levels. What's fascinating is that your body doesn't accomplish this alone. There's a partnership taking place between plants, your body's cells, and the beneficial bacteria living in your mouth. The nitrates found in beets first interact with bacteria on your tongue. Those bacteria help transform nitrates into nitrites, which your body can then convert into nitric oxide. Once produced, nitric oxide sends signals that encourage blood vessels to relax and helps regulate blood flow throughout the body. In a way, when you eat foods like beets, you're not just nourishing yourself, you're also supporting the microscopic community living in your mouth that helps make this process possible. This is one reason some experts recommend being cautious with harsh antibacterial mouthwashes that eliminate nearly all oral bacteria. While oral hygiene remains extremely important, completely wiping out beneficial bacteria may interfere with some of these natural processes. But here's an important question. What happens if someone lowers their blood pressure by eating beets regularly and then suddenly stops? If nothing else changes, the blood pressure often begins rising again. That's because the benefit came from a consistent dietary habit. Nitric oxide isn't something your body stores for future use. It must be produced continuously. To maintain the effect, nitrate-rich foods need to remain part of your routine. It's also important not to confuse the nitrates found in vegetables with the nitrates used in processed meats. They are not the same thing. In deli meats and processed foods, nitrates are commonly used as preservatives to extend shelf life and protect proteins. Even when these preservatives come from natural sources such as celery extract, they serve a very different purpose than the naturally occurring nitrates found in vegetables like beets. Understanding these differences can help you make smarter decisions about what you're putting into your body and how those choices may influence your blood pressure over time. In fact, processed deli meats can have the exact opposite effect on your blood pressure. By the time you eat them, chemical reactions have already occurred between the proteins and nitrites used during processing. Combined with the large amounts of added sodium, these foods can contribute to higher blood pressure through several different pathways. This is one reason your blood pressure isn't the same all day long. It constantly responds to what you eat, drink, think, and feel. Food isn't just a source of calories. Every meal triggers a cascade of chemical signals throughout your body. When you regularly eat oversized meals, consume large amounts of sugar, rely heavily on caffeine, take in excess salt, or constantly overeat, your body shifts into a more stimulated state. One of the chemicals involved in this process is norepinephrine. Norepinephrine plays an important role in your nervous system. Its job is to prepare the body for action. One way it does this is by causing blood vessels to tighten. When blood vessels become narrower, blood pressure rises and it becomes harder for the body to relax those vessels naturally. What's interesting is that food isn't the only thing that communicates with your nervous system. Imagine standing face to face with a wild coyote. Even before anything happens, your body begins preparing for action. Your heart rate increases. Your muscles tense. Your brain instantly sends signals that put you into survival mode. The same thing can happen during everyday situations. An argument with your spouse, a stressful phone call, financial worries, bad news, or overwhelming frustration can all trigger similar responses. The emotions you feel in those moments are connected to your sympathetic nervous system, often referred to as the body's fight or flight system. Once activated, that system increases norepinephrine production and blood pressure can rise as a result. The real problem occurs when stress never truly leaves. Fear, anxiety, anger, resentment, and chronic worry can linger long after the original event has passed. Over time, the body begins treating stress as its normal state. Even when the stressful situation is gone, your nervous system may remain on high alert because it never learned how to fully switch off. Think about a traumatic event. Maybe you received terrible news, experienced a major loss, or simply felt like everything in your life was falling apart. The body's response is immediate. Stress hormones surge. Norepinephrine increases. Blood pressure climbs. When you look at it that way, it becomes clear that this isn't a healthy long-term condition. Historical records provide a striking example. If you examine the blood pressure readings of Franklin D. Roosevelt during major events such as D-Day, Election Day, and the Yalta Conference, a pattern emerges. His blood pressure kept climbing higher and higher. Stress has a cumulative effect. It builds upon itself unless something interrupts the cycle. Unfortunately, Roosevelt lived during a time when modern blood pressure treatments didn't exist. Equally important, he never seemed to find an effective way to consistently manage the immense stress he carried. There is also another fascinating chapter in the history of blood pressure treatment. The first widely recognized blood pressure medication wasn't created in a laboratory. It came from nature. A plant known as Rauwolfia, sometimes called Sarpaganda, had been used in India for generations. Traditionally, it was used to help manage agitation, insomnia, and certain mental health conditions. Scientists eventually isolated a compound called reserpine from this plant. What made it unique was its effect on the sympathetic nervous system. Reserpine lowers levels of norepinephrine, essentially turning down the body's fight-or-flight response. Interestingly, this is the same system that can also be influenced naturally through practices such as deep breathing exercises, massage therapy, quality sleep, moderate physical activity, laughter, and stress reduction techniques. The difference is that medications and lifestyle strategies often work best when combined rather than used independently. Of course, there is a downside. Norepinephrine isn't only responsible for raising blood pressure. It also helps keep you alert, motivated, and energized. When levels become too low, people may experience fatigue, dizziness, drowsiness, nasal congestion, slower heart rates, and reduced energy. Some individuals also develop digestive issues such as stomach upset and diarrhea. Depression became another well-known side effect. Yes, blood pressure often improved, but many patients found the trade-offs difficult to tolerate. It's impossible to know what would have happened if Roosevelt had access to reserpine. Perhaps he would have benefited from it. Perhaps the side effects would have made him stop taking it. Either way, the medication eventually fell out of favor as newer and safer options became available. Now, before we continue, I want to say how excited I am that you're taking an active interest in your health. Nutrition and lifestyle changes can feel overwhelming because there is so much information available today. The good news is that improving your health doesn't have to be complicated. Small, consistent actions often create the biggest long-term results. And yes, stress absolutely plays a major role in blood pressure regulation. Roosevelt's story is a powerful reminder of that fact. Managing stress isn't something you do once a year when life becomes overwhelming. It's a daily practice. Whenever a person becomes seriously ill, the consequences extend beyond that individual. Family members are affected, friends are affected, coworkers are affected. Anyone who depends on that person feels the impact. The greater a person's influence, the farther those effects spread. When a president suffers a devastating stroke, the consequences reach far beyond his household. Decisions affecting an entire nation can change. Historical events can take different directions. Even the future of medicine can be influenced. After Roosevelt's death, a series of major historical developments unfolded. Leadership changed hands. National priorities shifted. New medical research initiatives emerged. Eventually, the National Heart Institute helped support large-scale studies that reveal just how damaging uncontrolled high blood pressure could be. Those discoveries transformed medicine and helped pave the way for the more than 200 blood pressure medications available today. Yet, none of those advances existed during Roosevelt's lifetime. At first glance, that might seem to explain everything. But the story is more complicated than that. The lack of medication wasn't necessarily the root cause of his high blood pressure. Modern medications almost certainly would have helped lower his numbers and bought him valuable time, but they still would not have addressed the underlying factors driving the problem. And that brings us back to the question so many people ask. If someone has high blood pressure, starts medication, and eventually sees their readings return to normal, should they stop taking the medication? It's one of the most common questions I hear. Rather than giving you a simple yes or no answer, I'd like to guide you through a few important questions first. By the end, you'll be in a much better position to understand the answer for yourself. Think about it for a moment. If your blood pressure is normal today because you're taking medication, what do you honestly expect will happen if you suddenly stop taking it? In most cases, the answer is pretty straightforward. If nothing else has changed, your blood pressure will likely rise again. The only way that outcome changes is if you've addressed the factors that caused the problem in the first place. That means changing habits, removing triggers, improving lifestyle choices, and creating an environment inside your body that naturally supports healthier blood pressure. This is where many people misunderstand what blood pressure medication is designed to do. These medications are treatments, not cures. If they truly cured high blood pressure, you wouldn't need to take them every day for years. The reason there are more than 200 different blood pressure medications available today is because none of them permanently eliminate the condition. They help manage it. Compare that to many infections. When antibiotics successfully eliminate the infection, treatment often ends. You don't usually continue taking the same antibiotic for the rest of your life because the underlying problem has been resolved. High blood pressure works differently. That's why if your goal is eventually reducing or eliminating medication under medical supervision, the focus must shift toward addressing the root causes. And despite what many people believe, those root causes are not usually genetics alone. Yes, family history can influence risk. But for most people, genetics are only part of the story. More than 90% of high blood pressure cases are linked to factors beyond inherited genes. Families often share similar eating patterns, stress levels, sleep habits, and lifestyles. When those habits are passed from one generation to the next, so are many of the health outcomes. If parents and grandparents developed high blood pressure because of decades of unhealthy habits, and those same habits continue through future generations, the results often continue as well. Today, nearly half of American adults live with high blood pressure, and a large percentage still struggle to keep it under control. Despite all the medications available, many people require 2 or more drugs just to manage their numbers. That fact alone tells us something important. High blood pressure isn't simply a number that needs to be pushed lower. It's often a signal that something deeper is happening inside the body. When healthy food choices, movement, sleep, stress management, and other lifestyle factors are ignored, the body naturally pushes back. Medication can help control the numbers, but the forces driving the problem may still be present. The danger is that people can become focused only on the blood pressure reading while overlooking the silent damage that may still be occurring. Kidney disease often develops quietly. Heart disease can progress without symptoms. Even small strokes can happen without obvious warning signs. In many cases, medication lowers the number on the monitor while the underlying issues continue to demand attention. That's why medications can be incredibly valuable, especially during emergencies or periods when blood pressure is dangerously high. They can provide protection and buy time. But when it comes to long-term health and longevity, there is no true shortcut. Consider the historical example we've discussed throughout this video. Uncontrolled high blood pressure contributed to the loss of a president during one of the most critical periods in modern history at a time when the future of the world was literally being decided. So when you ask yourself, my blood pressure is normal now, should I stop my medication? Another question becomes even more important. Have you done enough to create the conditions that allow your body to maintain healthy blood pressure without it? Because a normal reading while taking medication is not evidence that the problem has disappeared. Often, it simply means the medication is doing exactly what it was prescribed to do, protecting you while you work on the bigger picture. When I think about Franklin Roosevelt, I can't help but imagine the enormous burden he carried every day. He wasn't just dealing with physical pressure inside his arteries. He was carrying the weight of a world at war. That raises an important question for all of us. What pressures are you carrying? What worries, responsibilities, fears, frustrations, or stresses might be contributing to the pressure building inside your own body? Of course, I also understand that medications aren't always easy to tolerate. Many people report feeling tired, dizzy, weak, or simply unlike themselves after starting treatment. This is especially common in older adults who have lived with elevated blood pressure for years. Their bodies have adapted to functioning at those higher levels, so when blood pressure suddenly drops, the change can feel uncomfortable. That's exactly why communication with your healthcare provider is so important. Treatment targets are often adjusted based on age, overall health, and individual circumstances. What works perfectly for one person may not be appropriate for another. And yes, every medication has potential side effects. That's simply the reality of changing the body's chemistry. Before medication, your body had established its own hormonal balance. Introducing a drug alters that balance, which is why some people notice symptoms while others do not. The good news is that healthcare providers have many options available. If one medication causes problems, another may be a much better fit. Specialists who focus heavily on blood pressure management, such as cardiologists and kidney specialists, often have extensive experience helping patients navigate side effects and find treatments that are easier to tolerate. At the same time, don't forget about the factors you can control. Improving sleep quality can make a meaningful difference. Moving your body consistently throughout the day can help. Reducing foods loaded with hidden sodium is important. Limiting or avoiding alcohol may lower blood pressure for many people. Cutting back on refined carbohydrates and highly processed fats can also be beneficial. And incorporating whole foods that naturally support nitric oxide production, such as beets and other nitrate-rich vegetables, may provide additional support. When these habits work together, they can help lower blood pressure naturally and improve overall health while reducing reliance on medications over time under proper medical guidance. I know we've covered a lot of information in this video, and some of these topics deserve a much deeper discussion. So if you'd like to learn more about the specific lifestyle changes that can have the biggest impact on blood pressure, make sure to watch the next video here on the Weird Lab.